Welcome, everybody. My name is dr.rondamariechakolis, and I am with you today on For Your Health. Today is going to be a very exciting episode. I have one of my colleagues here, Dr. Doug Kennedy from the University of Minnesota. And much like I always do, I just need to let you know that the views and the opinions that I will express do not represent any of my affiliates that I'm employed with. So welcome, Doug.
Thank you.
It's wonderful to be here. Tell me a little bit about yourself and your background.
Sure. I work out of UROC, which is on the corner of Penn and Plymouth Avenue over on the north side. And my team is part of an NIH-funded project where we do non-drug and non-surgical interventions for pain. A lot of the work that I do is building relationships with community organizations and individuals, and then working with researchers, and how we can involve community members, more fully in the research process, and then also communicating what we're learning, both with our participants, community members, talking about research, but then also as our team's working more with scientists to say, here's how you can involve community members more through the research process.
So you said a big acronym. It was called NIH. And
Yeah,
so do you want to tell me what that
yeah.
stands for?
So that's the big federal agency, the National Institutes of Health, that funds our research.
Wonderful. So I grew up in North
Yeah.
Minneapolis, and research has kind of been a mixed bag for me.
Yeah.
Like, I am a scientist,
Hmm.
obviously, but on the other side, I've seen a lot of exploitation
Hmm.
in the community, and I think it's important that we kind of talk about how you and I even got here to be able
Yeah.
to have a conversation
Yep.
in this room. So, do you want to kind of take us back to the beginning
Yeah.
days and how that went?
Yeah. I mean, it's almost, when we think about it, like it's almost 5 years to the day that you and I had, I believe you called it the infamous red table discussion at Milda's. And 5 years ago, we were working with a community partner that looked at our research practices and how we're engaging community. And he said, this isn't good enough, right? You need to change this. And they really pushed our team to involve community members, to go out and listen to people. And so part of what I was charged with doing was going out and doing just that. And we'd had some listening sessions. We were talking to people, and I was given your name as someone to connect with.
Mm.
And so, our team had made some requests about some community conversations. And, I went back and even looked at the emails, and you and I have talked about this too, and what our team was asking for, and you were pretty upset with it. And I think you said, I don't mean to sound angry in this message, but we need to talk.
Mhm.
And in kind of this dialogue, we said this can't be handled over email. Why don't we sit down and do it? And then we met at Milda's and had, gosh, what was it, like a 2.5 hour
I think it was
conversation?
actually closer to 3.5,
Yeah,
almost four.
it was
Yeah.
really, and it was momentous. And then you and I, over the years then had this working relationship where, well, what are community interests? How can we do better? We were serving as sounding boards for each other. And eventually over time, it turned into not just a working relationship, but like a friendship too. You'd be one of the people that when I needed a sounding board, or like, okay, this is frustrating, we'd have a cup of coffee, and then that would be something like, okay, we can go do this again. Um, One of the fascinating things I think for me is that we how we both came to that meeting, how we talked about it, like what we were experiencing, because I know when I got your email message back, my first reaction was like, oh no, like we blew it. And what I was really curious about, what I wanted to know is, okay, how can I, as a researcher, part of this team, do a better job? And I knew in that meeting it was gonna be uncomfortable because you were obviously upset, you were angry, and just taking that time to listen. But I think also, hearing it from your side is
Right.
is really interesting because there were two people sitting at that table.
Right. And so, again, um, ties in North Minneapolis, like I've seen some of the abuses that have come from the University of Minnesota and other institutions. And the university, when I was growing up, had this exceptional status,
Yeah.
which I learned that exceptional is not a good thing when you're in research. It means you have to have some extra things and dot some I's and cross some T's. And so the main reason I even came to that table is one of the community elders vouched for you.
Hmm.
Um, at that time in my career, I was practicing pharmacist. I wasn't on the board of
Hmm.
pharmacy. I was working on a master's of public health, but it was like I realized what I was seeing. And part of that was I was learning my own value
Hmm.
as a healthcare professional.
Yeah.
I recognized that you were only doing what you were asked because you didn't know any better, like historically. And I think to give people some insight, what I was angry about was
Hmm.
like, hey, just for the greater good, can you show up
Yeah.
and do a presentation? And by the way, the university may own this presentation and, like for residents. And so I really want to thank you
Hmm.
for meeting with me because I had the opportunity to
Hmm.
reflect on those emails myself, and I was like, "Holy cow, this man still met with me." And I can remember you really listened, but you took a very verbal, I would say, beating, so to speak, for old and new. And I think I would in that time I gave you some examples as to
Hmm.
why that wouldn't fly. To
Right.
your credit, you took all of that in. You took a lot of notes, and you kept saying, thank you
Hmm.
for this."
Hmm.
But when you came back,
Right.
um, and as our time evolved, tell me how it was like when you came back, because I can tell you what it was like for me when you came back and you
Hmm.
were like, I'm going to work on this and come back to you a different way. And part of me was like, well, he sat here for almost
Yeah.
4 hours. He seems credible,
Hmm.
but let me see what he's really
Right.
about.
Yeah.
So, yeah, take
Yeah.
us
I
on that.
mean, because I mean, some of the things that, we've talked about with research over the years too, is that sort of performative nature, right? People kind of check a box, we've gathered community feedback, but what's happening with it? And, it's talking with you, and other folks too, that follow through is really important, right? Or else it just becomes like every other project, or every other, or like a lot of other studies in the past, not to, throw everyone in that. Um, but it was important, right? When we sat down at that table, yeah, there was, I was listening to you, but you also took the time to do it because there was, you were under no obligation to get back to me. You didn't have to. And there's that idea, and I think sometimes it's really important, and this is something we talk about in our team, is to, never forget that when community members are sharing their stories, they're providing feedback, insight, that's taking time, that's effort, and that's a risk. So, like internally, that ethical piece, right? That compass that says, I made this commitment, we need to do this, and um, and valuing that honesty, because a lot of times too, you know, when we were talking about, community members doing unpaid work, right? Or not being acknowledged for their work, right? These are legitimate pieces. And, going into the research literature, we've known about this for, better than 30 years, as well as how to change that trajectory, what needs to be done. But it was really important that, to say, well, here's what we can do right now. Here's how we're going to continue to work on these things. Um, as you've worked with our team and you've even traveled, like to NIH, your own scholarly work too, we've talked about how there are a lot of barriers and institutional barriers, structures that are put in place, the way that researchers are trained, that there are some pretty steep hills to climb. And that, some of the work that we're doing, and it's fantastic now over years that we're able to say, hey folks, take a look at this. We're getting some attention, to show other researchers you're not giving up rigor. You're doing great work, but you're going to have to earn the trust of the communities that you're working with, and you're going to have to work with maybe some, or challenge a lot of the assumptions, the practices, um, the habits in your training too, and that's really hard. But to get back to your point, it was really about that transparency, honoring the contributions that you were making, um, that was really most important in those subsequent conversations.
Well, thank you for that. But to your credit, I think we should kind of just let people know we're
Yeah.
using a lot of terms with
Hmm.
research.
Yeah.
Kind of to backtrack, there are rules of
Yes.
engagement that we
Yep.
have to follow.
Yep.
We have these institutional review
Right.
boards. We have certain protections for people who are in studies. What you're telling me is we haven't really had good documentation or best practices for how we involve community. And to your credit, I think I remember saying to you very bluntly, and for
Uh-huh.
people who know me, know I can be quite
Blunt.
blunt.
Yep.
Um, don't come back to me unless you have this right
Mm.
and you're writing in some form of compensation.
Mm-hmm.
Um, I was, like I said, I think I was going with my heart, but what I recognize is you did something that was groundbreaking at the time.
Mm-hmm.
You got community members compensated. And again, when we say compensated, there's no way we can really truly
Compensate.
compensate
Yeah.
somebody for a lived
Yep.
experience or their contributions to something,
Mm-hmm.
but you got them compensated at the National Institutes of Health research level
Mm-hmm. Yeah.
hourly rate, which is
Right.
$100 an hour.
Right.
At the same time, it sounds like it might be something that you can make a lot of money off of,
Mm-hmm.
but to your credit, you understood that you had to be very judicious with your funding
Mm-hmm.
and utilize people, not use them, but
Mm-hmm.
utilize people in a way that was very um, conscientious and mindful of budget.
Yeah.
So I found that meetings were very productive
Mm-hmm.
and there was an agenda, but
Mm-hmm.
there was room for discussion. One of the things that I think sets this Partners for Pain research apart is the development of this community advisory team.
Yeah.
Do you want
Yep.
to tell me more about that?
Yeah, I mean, a couple of things. If I can go back too on a couple of those pieces, I was sitting on the couch talking with my wife, and her comment, and she says it all the time, is researchers, no one talks like you. And that point that you're highlighting is that, when we talk about consenting or these processes, there's a real opportunity for people that aren't in that all the time, right? And it could be in any profession, but to help people understand what that is and then what could appear, the consenting process, is laborious, right? There are a lot of words there that we have to make sure that we say, but the whole point is it's about keeping people safe. But that being able to say, okay, this is why this is happening. This is how we're going to use your data, right? Addressing people's fears and concerns is really important. So it's that bi-directional communication. I think, we had talked about it with our team and this larger kind of community and researcher team around understanding where each other are coming from as we move towards this common purpose of community health, right? So to to your point about the community advisory team, we felt it was really important that we had community feedback on what we were doing. And by that, I mean, from like with this grant that we're doing, this Partners for Pain grant, we saw that it was announced it was going to look at back pain, which affects, 80% of the US population. It's the second most disabling condition in the world after COVID. We spend more money on it, but that's an important thing. And our team cares deeply about people that live with pain. But we went to our community advisory team to say, okay, this is what they're looking for. This is the population that they're trying to target, right? Like who should be part of this study. And they were looking for folks that were low socioeconomic status, racialized and ethnic minoritized communities. But we brought it to you and other members on that team to say, is this something that we should do? And that was the feedback. And if it was going to be no, then that was it. But that cat comes then into, well, how can we message this? Who needs to be at the table for these conversations? Here's how we're going to tell participants that are in our study the results. How should we gather them? You've helped in with focus groups, right? Bringing people together to get that feedback. So, this team has been a real interesting evolution because, some people early days were doing it even without compensation because they're buying into the vision. And then we could actually get that equitable compensation, scientific and community members being paid the same. One other interesting thing to note about it is that sometimes, there's a lot of buzz or a lot of jargon around like co-development, co-creation, being with community. But when we look at that cat, we came up with a charter, right? A document. And we worked it out together. We look at it every single year that would include things. How are we going to work together? What are our values? What are our goals? Like, how do we know if we've been successful? Things like compensation, that's really important. Hours, who's going to do what work, and then also about the contributions. So if people are putting in their work and hours and insights into, let's say, a presentation or a manuscript, right? Professors, we hear a lot of times we're writing manuscripts or trying to advance knowledge that way, making sure that people's names are on that, giving credit where people's effort is.
So one of the themes, it sounds like, is really transparency. And so from
Yes.
my viewpoint, I've been involved in a lot of projects,
Mm-hmm.
state and federal projects, but this has been very different.
Mm-hmm.
One, because we had that charter.
Mm-hmm.
Two, because we have a process to bring on new people,
Right.
onboard them, kind of vote on things. But really, it's the co-development
Mm-hmm.
piece
Mm-hmm.
that has been really wonderful for me. I can remember early on when materials were brought to me, and we're talking about my big passion is health literacy,
Yeah.
right?
Oh yeah. Yeah.
And I can calculate reading level, and I'm
Uh-huh.
like, it's got to be at a sixth grade reading level
Yeah.
because of how people understand
Mm-hmm.
things. And so just having the opportunity with people like Makeda Zulu and
Mm-hmm. Mm-hmm.
Clarence Jones and
Yes.
Sam Simmons and a number of other people, um, where we actually sit there and we go through these documents
Mm-hmm.
and we vote on it, and we're like, ah, that won't
Mm-hmm.
resonate with my community, or this does well. So that's
Right.
very different. Also, fast forward when you talk about, um, it's kind of like I've been involved in projects where it's like I could do all of the work behind the scenes, but
Mm-hmm.
when it came time for the shiny things or
Right.
things in front, wasn't always welcomed at the table.
Mm-hmm.
I can tell you what was really fantastic for me was being able to go to Bethesda,
Mm-hmm.
um, and talk about the work that we
Right.
were doing here,
Yeah.
and them saying, well, you're a pharmacist and a community member. How
Mm-hmm.
does that work?
Yeah.
And all of that. And so I think what I was most proud about was one, being like a brand ambassador, because
Mm-hmm.
people were like, I can't believe you're able to move the needle on some of these research metrics.
Mm-hmm.
But it also was the relationship building
Mm-hmm.
that we developed. And I think we can go into that more, but
Yeah.
I
Yeah.
think I'm
Yeah.
really proud of something that happened there. You got some kind of award. Tell me about that.
So yeah, I got surprisingly, I was actually traveling with my family and I got an email that said I won a award from the National Institutes of Health on community relationships, and I had no idea because this is the work, right? And I sometimes feel like I get to do the best work in the world. I get to work with these amazing people on something that's impacting communities, that's impacting, people in my neighborhood. Um, and and then of course I caught COVID and couldn't go to go get the award. But it was really nice to be recognized for this work, which, was slow moving right on our team. Um, but when it was kind of like this nice recognition of the importance of building relationships, not just gathering people to say that you gathered people, but to do the work of really listening, of having relationships that, our team just isn't talking about, but our community members that work with our team are talking about. This feels authentic. I can speak frankly, I can be honest, I can show up as myself, and I know that I'm going to be listened to. And so that award was nice because it was a piece for me and for our team that said, what we're doing is getting some recognition, and that was really, I think, important
Mm.
for that. And I wish I could have been there with you and Makeda, and our other team members. Yeah, it was a nice piece.
So, I mean, for me and for people who in the audience might know, this is very groundbreaking. This work is not easy. So, some people
No,
would say this would not put you on the tenure track. Certainly, you were the exception because you got this award, but why would you want to work this way? Tell me why you would want to do research this way.
yeah. I mean, so there are a couple of things, right? So the first is, like our team cares about pain, right? And people are living with pain. The next piece that we have to be, that we're really conscious of is that, like if we look at pain writ large, well, then we know that like in the medical system, not everybody's being treated the same. Not
Mhm.
everyone is being treated equitably in this, and we could go into all the stats about medication, about how people are being treated by medical providers. And I guess maybe it was some of that, how I was raised, but I've been working with people as an educator, before this for more than a decade, decade and a half. And it feels like it, if there's something out there and you can do something about it, right?
Mhm.
Not like fixing it all, because there's no way we're going to fix complicated
Right.
problems all on our own. Um, but to do something about it in my lane. And if I can connect with a lot of other people who are working on the same thing, then we're going to do better. And the other piece too is that, I remember being challenged by, the elder that you were talking about saying, you know what, this is not okay.
Mm.
You need to do better. And looking at it going, yes, we can. So how are we going to do it? Right. I think those of us that go into education or that go into research, right, we got that curiosity. So it's like, well, let's figure this out. And the other benefit of it is, I think from like a scientific standpoint, from a research standpoint, you know, not only are we doing rigorous research, right? And sometimes you'll hear some other researchers, well, you're not going to have that, right? If you do work this way, and they're counseling their graduate students out of doing it. Um, but we can have rigorous research. We can have deep relationships. We can get rich data and really figure out, okay, what can we do here? And we can do it with an exceptional group of people. It can impact our communities. I kind of pinch myself a little bit. I mean, as trite as that sounds,
Mm.
but we can have these relationships. We can go deep on this, and we can do good work. I mean,
That's important.
yeah,
I think people would ask me, what's my why, right? Because I
yeah,
think historically, from my community's perspective,
mm-hmm.
research, there's abuses and
Oh
it's
yeah, yeah,
scary. And it's, people get Tuskegee
oh
wrong and we
total,
talk
yep,
about, Henrietta Lacks, those
yep,
things. My why is because I know research is going to happen
mm-hmm.
regardless,
Yep,
but it also is a way for me to help shape
mm-hmm.
some of the questions, but also making sure that that information gets back to
Right,
community, not just in a way that make researchers feel
mm-hmm.
comfortable, but to community in the form of like
Mm-hmm.
PowerPoints or
Yeah,
presentations, or just really, you know,
mm-hmm.
being there.
Right,
Also, my why is because I'm like, there's this thing that I was taught in school that it takes 10 years
mm-hmm.
after research study is done to put it into practice.
Right,
And I always say that's because I wasn't involved.
that's
That's my
right.
narcissistic kind of way, but just saying that's just something I refuse to accept.
Yeah, yeah,
I certainly can see that there's been a lot of changes, even in the way people think about it.
mm-hmm.
So, we're making the sound all warm and fuzzy, right? Like
Mm-hmm.
5 years is a lot. There were a lot of meetings. There
Oh
were
yeah,
lots of you. I'm looking at the stack of emails that you
mm-hmm.
printed out, and I had the opportunity to read. What
Mm-hmm.
does it take for you to work or stay in this space?
Um, well, a couple of things, but is it okay if I come back to a point that you said,
Yes.
so when you were talking about like getting back to people, or about the abuses in research too, I remember our first, and it connects to the why, like the why do you do this? And I remember the first listening session that we did, and it was at UROC, so over on the north side, over by the Urban League, and one of the participants showed up half an hour early, and we're setting up and everything in the room, getting food out for people, and they were carrying a book with them, and it was underneath their pocketbook, and they showed up a half an hour. I'm like, well, this person wants to have a conversation, right? You don't show up that early and just sort of wait. And the book, was kind of angled towards, where people could see it, and it was Medical Apartheid, right? I'm like, oh, okay, like I know this book. And, this community member had some really, really strong views about research, and they wanted to make sure that, that we heard them. And this person is someone that we still get back to. This is someone whom we connect with, we have breakfast with, because I like our team cares deeply about what this particular individual, and they haven't participated in our studies or anything, but they've been with us, and cheering us on, for these past few years, and we care what she thinks, right? And then there's that other point too about like getting information out to people, right? So like when we had our pilot study, we made sure that we took those results and we put them on our website where people can see them. And then we're going to bring people back so that they could listen to it, like, okay, hey, what are you thinking? What else could we do? Right? Because people have given their time, and we do compensate people for it, like we pay people for it. Um, but they're also giving their effort, right? And they've got something, they're going to be looking at it in a perspective that we may not have. So that's vitally important. That was something I remember talking a lot about, um, in the cat. But to that point, right? Like, what does it take to do this? Um, I'm going to attribute. I'm going to have just a call out to our one of our principal investigators, so my supervisor, right, person that's overseeing the study, um, because there was a lot of leadership there, and I'd be dishonest to say that it was always an easy relationship. That I would be talking with you or other community members and saying, well, I think we need to do this, and she's trying to do these studies too, so we clashed a lot. But to her credit, she really started to get like, okay, what does it take for researchers internally, right, to question, to examine their not only their beliefs, right, their values and their practices, and she led in that. Um, but I think when we unpack some of that, researchers have to know their positionality, what they're bringing to the table. They need to know what community members are thinking about research, understanding community needs. And then they need to be able to also be open to having those perspectives challenged. And our team worked on that for uh, years and still does it, right? But instead of having it be like a training, now it's just part of the way that we do our work.
So it took work.
It
So I
took
mean, I
a lot
want to
of
say
intentional work. Yeah,
that, but it meant like I always call it like a tutoring
yeah,
or after school program. It meant
yeah.
that you had to put in a lot of work outside of your normal
Mm-hmm.
hours.
Yeah,
And again, it sounds like you also had to do some translation
yeah.
um, to get some buy-in from your colleagues. I would say like our worlds are like two parallel things, right? Because
Mm-hmm.
again, I'm a graduate of the University
Yep.
of Minnesota.
Yeah.
Some things weren't necessarily great when I was there, but people are like, don't go to that place or
Yeah.
don't work with them.
Mm-hmm.
I want to go back, and I think
Mm-hmm.
it's important that we name your principal investigator.
Yes.
Her name's
Mm-hmm.
Ronnie Evans,
Mm-hmm.
and it's just important that we recognize her because, again, as a woman in science,
Yeah.
I can imagine what it was like. I know I've been afforded a lot of opportunity for women who've gone through things.
Yeah.
But, with me being the first to be the first Black woman to be on the
Mm-hmm.
board of pharmacy and now the president of the board, it was interesting that I found myself going to Ronnie and developing this
Mm-hmm.
relationship where it was like, tell me what it's like doing the first things or tell me
Right.
what it's like doing groundbreaking things, and to this day like we have a wonderful
Mm-hmm.
working
Yeah.
relationship, and she's actually helped open a lot of doors for me
Mm-hmm.
academically. Like
Yeah.
I think what this makes this so different is also it's not about you coming to the community,
Mm-hmm.
you're also bringing people to the
Mm-hmm.
university.
Yeah.
um, I have these degrees, right? But
Yeah.
there's some things that I've wanted to do. I've always wanted to get another PhD and get the research stuff done,
Yeah.
but I didn't find the right people to connect with.
Mm-hmm.
The other thing you're doing is you have a wonderful graduate student that you're working
Yeah.
with. What's her name, by the
Dola
way?
Green.
Okay, right. And she's rooted in community.
Mm-hmm. Mm-hmm.
Very, very bright,
Yes.
talented young lady. And
Mm-hmm.
so, what I think is different is this isn't just about this particular project.
Right.
It's about being sustainable, but also kind of building skills in both worlds.
Mm-hmm.
And
Yeah.
so I think that that is really, really important. I know like you and I can talk forever, but I
Yeah.
think we need to get to the reason why we're here. And
Mm-hmm.
that is tell me what Partners for Pain is,
Yeah.
so that people know what we're talking about.
Sure. So, Partners4Pain is funded by the National Institutes of Health, and we're working really where health disparities, right, when we're talking about worse outcomes, in particular for people of low income and that are minoritized populations, and pain intersect. So, when community members have asked me about research, and kind of seeing that reaction, like, are you going to take my blood, my spit, you're going to look at my DNA, are you going to cut into me, what's going to happen? Or like, actually, these programs are about helping people manage their pain on their own. And that's really important because we know while this condition is really, widespread, um, a lot of the things that are typically prescribed for it, the evidence base isn't so strong. And we're seeing actually we can do these programs that can help people live better with it. So they're 9 weeks long. You meet in a cohort, a group of people, so you've got support there. There are videos and workbooks, and it teaches you how to better manage your pain using different techniques. So we've got two programs. They approach it a little bit differently, but these are programs then that could be, once we finish figuring out, how effective they are, how do they work, that could be rolled out in, let's say, a church, a temple, a community center, right? So folks that don't have insurance, or who may not want to go into the healthcare system because of, mistreatment, they could go somewhere where they feel more welcomed, and reducing those barriers to getting care.
So I can say as a pharmacist, why am I'm 100% on board with this. I think
Yeah.
you touched on the issue that there are these disparities,
Mm-hmm.
right?
Mm-hmm.
I can tell you, I started practicing pharmacy in 2009,
Yeah.
and I would like to call that the OxyContin years,
Yes.
where I saw OxyContin just fly off the
Mm-hmm.
shelf, and
Yep.
Percocet and opioids. But what I was finding out is people in my community did not get those prescriptions.
Right.
Very few people
Mm-hmm.
did. People actually, when I was working in North Minneapolis, would come from the suburbs
Yeah.
to fill their prescriptions. And so, what we know, a lot of those pain medicines, while they have a role,
Mm-hmm.
um, they're not necessarily the mainstay. This kind of mind, body, and these other
Mm-hmm.
interventions are cutting edge.
Mm-hmm.
Again, for my community, I like people to be at the cutting edge. The other thing is, with a lot of these interventions, they've been around for a long time. Um, we know that they work, we know that they're safe
Mm-hmm.
for the most part, and we know that they're effective. And
Mm-hmm.
it's amazing that now that we've gotten this kind of backlash from the opioid crisis, that
Mm-hmm.
people are like, well, these did kind of work all along. I think now it's just important that we kind of, and what your work is doing is kind of helping create that narrative and get buy-in, but also shape it in a way that community can digest it. You kind of talked about, what the programs look like, and
Mm-hmm.
again,
Yeah.
my goal is to kind
Mm-hmm.
of bring researchers on to kind of disseminate or give the community
Yeah.
back this information where
Mm-hmm.
we're at.
Mm-hmm.
But we talked about what the programs look like.
Mm-hmm.
We also talked about like, how long. I don't think we really talked about how
We can
long
talk
this is
about
going
it.
on, huh? Have
Yeah.
we?
No, so we will be doing these programs until 2027.
Okay.
So, for people that would be interested in learning more about it, maybe participating, because, if we don't have back pain, probably someone we know. It's an aunt, an uncle, a neighbor. So we'll be doing cohorts, groups, really almost quarterly from now through 2027. So it'll be going on quite a long time. And, like you had said, we've we're seeing this emerging evidence base that these things can be really effective. And people with back pain, whether they're thrown off opioids, back in the mid 2000s, people are looking for relief, right? And the population that we're typically working with are people that have what's called high impact pain. So pain that's affecting their daily activities, pretty profoundly, right? It's not just one day, it's not slight, but it's interfering with their life. And so we're trying to get better at this, trying to figure out, okay, is this approach going to be effective?
Yeah. So I think that's great. And I know we kind of touched on
Yeah.
like what your role is
Yep.
in the study, but tell me like how big is this team? Like this sounds like
Yeah.
it is it a one person, two-person show? How
Definitely
big
not
is
one
this team?
person,
Yeah,
right?
okay.
So, and if people want to see, like, right on our website, and, we talked about like transparency, we wanted people to see who's on our team, right? Why we're doing the work, answering that why, right? So like your picture's on there, for example, but you could go to partners4pain.org. So it's on our t-shirts, and we'll have it on the site too. But people can see our team, and they'll see our community advisory team, they'll see our research team. So we've got facilitators, we've got analysts. I do some of the qualitative analysis, the community engagement. So, we've got a fairly sizable team. This can't be done by a single person. And we also have community partners as well, such as the YMCA of the North, the YWCA of St. Paul, the hue-man Partnership, and North Point Health&Wellness. And we put UROC in there because that's where our team is housed. Um, and that's really important there too. So it takes a lot of people to do the scientific work, to provide insight into this, to implement it out in the community, and to make sense of this, and to help support the work that we're doing and getting that message out. Because, sort of as we started this conversation, when, I've been at like, Juneteenth celebration or open streets or volunteering. Like our team is frequently volunteering at North Point Free Fresh Food Fridays or in the food shelf, and people hear you're a researcher, there's that immediate like, ooh, are you gonna cut into us? Like, what's gonna happen? And having time to just sort of help people understand what this is, to have the questions, to see how they're going to be treated, is really vitally important.
So yeah, you're talking about that long going
Yeah,
relationship building
yeah,
process. And just because you have a foot in the door, you're still working. Like you still,
absolutely.
I would say you still make more time to be engaged with community. So as we wrap up,
Hmm.
kind of talked about these cohorts or
Yeah.
groups.
Hmm.
Tell me how people can get involved and when the next one is coming
Yeah.
and what
Yep.
have you.
Yeah. So our next set of groups, cohorts will be happening in late January, early February. We run them. We try to make it easier, right? If people are working, we have our programs that are running in the evenings. So they'll be Tuesday nights, and those will be at UROC. We provide transportation for people so they can get there. We'll also be running them on Saturday mornings using Zoom because a lot of people, are real comfortable. Maybe they feel more comfortable in their home, and you can access Zoom on your phone or a tablet. Uh, but to get involved in it, you can go to our website and you can go to join a study, and we'll make sure to have those links there. What people will do then is when they click on the join a study, we want to make sure that they have the right type of pain, that this is going to be a good fit for them. And then we want to start letting people know, like, okay, this is what's going to happen to you. So you'll take a short screening to get you in the system, and then one of our teammates is going to call you, um, and we'll start the ball rolling that way. People will go through a series of what we call screenings, and again, it's asking questions, making sure that you understand what's going to happen to you, that this is really important thing, like this is voluntary what we're going to do with your data, um, and to make sure that you can do the program and you're willing to do it. So that's a very complicated process. Our team is always there to answer lots and lots of questions. I do some of these conversations. My other teammates are doing these conversations with people, um, and we're starting that right now. We already have people that are lining up, and we're really excited about that. Um, I've facilitated the programs in the past, and they're really. I mean, to kind of build on your question, I mean, it's really exciting to see the support that people feel by this, and that people are feeling supported by the staff too. Like, I want to show up. I want to be at these programs. I want to see my group. When we had our community day at UROC, when we had our results meeting, it was really nice to see how the research team and then like the participants would come back together. It's like, hey, I haven't seen you in a while. Like, it's good to see you. And I always look at that as kind of being this test. Are we doing right by people in our studies?
Well, that's really good. And I would also say, and that website isn't just about joining that study. There's
Right.
also information there for people if they're looking at just trying to understand what this project is really about.
Right.
Um, I know, like I said, you and I can talk and talk forever.
Right.
Um, what are your final thoughts that you want to share with people as we wrap this segment up here?
Mm-hmm. Um, Gosh, there's a lot. Um, but I think, one of the most important things, or one of the things that we're learning from research, and um, I think it was actually Clarence Jones from the hue-man Partnership, who we've been working with for a number of years. He was part of our early work too on a different study, is that, when you have these relationships, we go further together, right? There are people that want to participate, um, but you can't just put it on community members to give, right? You can't just put it on folks to volunteer. There has to be that intentionality on researchers in how you're doing your work and being critical and then being open to it. And when you do that, um, my team talks about how, and these are, researchers that have been in this particular field for decades. Things like, I really found my soul in this research, or I really like coming to work here, or how just moved they are by doing this work. It reinvigorates them. And if we're doing that, and we can affect people where participants are excited to see us and researchers are excited to do the work, I mean, that helps that, community well-being. That helps us point towards that, right? We can do a lot with that. I hope people see it, but it's that partnership and that relationship. Um, but you need to be open to it.
Well, I want to say thank you so much for being here today. And I'd like, thank you for putting up with um, me for the last 5 years.
And
You're
likewise, yeah.
certainly, I know we're going to be working together, but my final words for the audience is that research does not necessarily have to be scary. And I think what this particular research has done has kind of set the stage or the standard for that when researchers come to community, like if you're not following the rules, if there's not co ownership, if there's not um, engagement, if we're
Hmm.
not presenting together or working together or developing one
Hmm.
another, maybe that's not something you want to be involved with, but you can also challenge researchers. Again, thank you for being here.
Thanks for the invite.
I know we'll be back on this episode on the show to talk about like how we get that
Yeah.
information back to people.
Yeah.
So I'm Dr. Rhonda Marie Chakolis, and we've been here today with For Your Health. Thank you.